So, the vision of a person, there is a obscuration while reading, dim sight by candlelight. There is a blindness on rising and standing after a sitting bed over. The field of the vision reduced one half, continual movement of a bright circle before the eyes, object look too large. The characteristics are there is a oversensitiveness of nervous system, hence the extreme sensitiveness to touch and cold air and to cold application. Sensitiveness makes the subject irritable with a hasty speech and action. So clinically, one of the most frequently used eye remedy and acute phlegmonous inflammation with the pustular and ulcerative keratitis with a great intensity of symptoms, deep slugging corneal ulcer with a hypopia, there is a corneal abscess, keratitis, Sattler or purulent conjunctivitis. Then jacquerie. Jacquerie is the crabs are white. There is a purulent conjunctivitis, epithelioma, lupus, ulcer, granular reed inflammation spread to the face, named granular ophthalmia and keratitis. Next is the lilium tick. So objectively there is a lacrimation in the eyes and lid margins are red. Subjectively, patients feel that there is the eyes are burned, feel sandy or near vision, feel every week, eyes are smart, sharp pain over left eye in the open air, disposition to cover and press open the eyes. There is a retinal hyperesthesia. Vision blurred with a heat in the eyes and lids extending back into the head. Stenopia, spasmodic astigmia, spasm of accommodation with smarting, difficult to open even on rubbing in the morning. Eyes are dry and dim, eyes dry in the evening and night, itching in both the cancer, with inflammation of the right lid, distressing pains as if they were dry, with a nightly agitation and pressure pain in the eye as common dust stitches in the eyes and night. So, mercurius is a deep and chronic remedy. In these objectively, we see the upper lid thick and red like the skies, eyes inflamed with a swollen dark sky, and very sensitive to touch or light, lids spasmodically closed, acrid lacrimation, there is a morning agglutination, eyes are forcefully drawn together, inflamed swelling in the region of the lacrimal pore. Subjectively, there is a photophobia, gaslight, intolerance of light, and firelight. Heat, redness, pressure in the eyes, burning and biting, sensation of a cutting substance upper under the left upper lid. The visions are dim, a fog before one or both eyes, eyes drawn together by trying to look at anything and cannot see it distinctly. The more she tries, the less able is she is restrained the contraction. She is obliged to the lie down and close the eyes, blinding by the firelight in the evening. The characteristics of is mercurius aggravation at the night. Discharges are thin and acrid by the glare of fire. The syphilis is marked, dacryocystitis, syphilitic lacrimal fistula, eyes trouble from working over fire, ophthalmia neonatal, superficial inflammation of cornea, conjunctiva, cattle, panacular or ulcerative conjunctal, redness, variable, usually marked, sometimes cirrhosis, keratitis, useful for hereditary syphilis, keratoiditis, with or without hypopia, episcleritis. Mercurius pain are generally severe, more frequently tearing, burning, shooting, or sticking, and not confined to the eye but extend into the forehead and temple. Temple often sore to touch, iritis, retinitis, choroiditis, optic neuritis. So next one is nitrum mood. The nitrum mood in this feel a bluish with a headache in a school children. Eyelids are heavy, muscle weak and stiff, letters run together, see the sparkle, fiery zigzag appearance around all the objects, burning in the eyes, blew out on a reading, on writing. Picture of lacrimal duct with a suppuration, a scab of a mucopus vein pressing upon the sac. There is a lacrimation and burning in the acrid, the lids are swollen, eyes appear wet tears. Asthenosine due to the insufficiency of internal recti muscle, pain in the eyes when looking down, and cataract incipient. Nitric acid. There is a double vision, spark, sticking pain, appear and disappear quickly like a belladonna. Offensive discharge, ulceration of cornea, glomerular ophthalmia, photophobia, constant lacrimation, syphilitic iritis, work in the evening, night, cold climate, and also hot weather, better by riding in a carriage. Petroleum. There is a loss of eyelashes, dim sight, farsightedness, cannot read fine print without glasses, glenoria of lacrimal sac, marginal blepharitis, cancer fissure, skin around the eyes, dry and scurfy, work in a damp place, passive motion, winter, better in a warm air, dry weather, lying with a hair. Phosphorus. Objectively, eyes are sunken and surrounded with blue rings. Eyes seem large, edema of a lid, and around the eyes there is a ptosis, myopia. Subjectively, there is a aching and burning pain in the eyes, and stiffness and heat with a dull pain after reading. Visions, object look red, later look red with a reading. When reading, there is a hemianopia. Day blindness seen more distinctly in twilight than during the day. Eyes given out while reading, very sensitive to external impression, myopia due to or increased by a severe spasm, and have been reduced perceptibly with a 2x interval. Phytostigma is useful in a follicular conjunctivitis, increase in myopia, contraction of pupils, twitching of ocular muscle, night blindness, photophobia, glaucoma, flashes of light, partial blindness, paresis of accommodation, profuse lacrimation, astigmatism, spasm of severe muscle irritability, reductive in the eyes, post-discrete paralysis of eye and accommodation of muscle. Then jaborandi, which is the pilocarpus microphilus, is used when the eye spread from whatever cause, irritability of severe muscle, eyes easily tired from sightless use, heat and burning in the eyes on use, everything at a distance, appear hazy, vision become indistinct, every few moments, retinal image retained long after using eyes, there is a irritation from electric or other artificial light. Pupil contracted, do not react to light, staring eyes, white spot before the eyes, smarting pain in the eyes, clear twitch, atrophic choroiditis, spasm of accommodation while reading. In the pulsatilla, there is a thick, profuse yellow blood discharges, itching and burning the eyes, profuse lacrimation and secretion of mucus, lead inflamed, agglutinated styles, veins of fundus, oculi greatly enlarged, ophthalmia neonatal, subacute conjunctivitis with dyspepsia, worse in a warm room, heat, rich fat food after eating and towards the evening. Better in a open air, motion, cold application, cold food and drink. Rust stop. In a rust stop, there is a swollen red edematous, orbital cellulitis, pustular inflammation, photophobia, profuse flow of yellow pus, edema of a lid, suppurative iritis, lid inflamed and agglutinated, swollen old into eyes, circumscribed, corneal injection, intensive ulceration of cornea, iritis after exposure to the cold and dampness, of rheumatic origin, eyes painful or turning it on pressing, taking gush of hot, scalding tears upon opening the lid, worse cold wet weather, rainy night during rest, better in the warm and dry. In the ruta, objectively, eyes filled with the water, subjectively, patient deep in orbit, pain as from a bruise in the tarsal cartilages, pressure over the brow, stitches in the left frontal bone, only while bleeding, itching in the inner canthus and lower lid after rubbing, become a biting so that the eye filled with water. Eyes are burned, egg filled, strained from overtaxing them in near vision, sensation of heat, fire in the eyes, and aching while reading. There is a weary pain in the eyes after reading, coldness beneath the left eye. Vision, there is a blurred vision from the overtaxing in near vision. Very weak as if eyes were excessively strained, object dim as if shadow flitted over them. Characteristic in rheumatic subject or after trauma in bone, joint, muscle, cold, wet weather, motion with a general feeling of soreness as from a bruise, backache, clinically in asthenosphenia, more often from a weakness of the ciliary muscle than of internal recti, heat and aching in and over the eyes, which feel as if they were ball of fire, night lecture run to. Sepia, there is a muscular asthenosphenia, black spot in the field of vision, asthenic inflammation, and in connection with nutrient trouble, aggravation of eye trouble, morning and evening, tarsal tumor, ptosis, ciliary irritation, venous formation of the fundus, water, forenoon and evening washing dampness, and better by exercise, pressure, warmth of the bed. Cilicia, the angle of the eyes are affected, swelling of lacrimal duct, aversion to daylight. It produces a dazzling sharp pain through the eyes. Eyes are tender to touch, worse when closed. Vision confused, later run to weather on reading, sight, iritis, iridochoroiditis with the first in the anterior chamber. Perforating or slugging ulcer of the cornea, abscess in cornea after traumatic injury, cataract in opaque purple after effect of keratitis and ulcer cornea, clearing the opacity, use 13 potency formula. Then you pass stimulus. So this is a very rare and very useful in a conjunctivitis. When we see you pass 3, it is the trichomoniasis spinatus, produces the tonic spasm, tetanus, asphyxia, pain in the eyes and orbit with the conjunctivitis, dull, sunken eye, and sight. So these are the homeopathic therapeutics useful in a conjunctivitis. Lupus is also called as spinospinatus, produces tonic spasm, tetanus, and asphyxia. It is a rare but very useful remedy when there is a pain in eye and orbit with the conjunctivitis and dull sunken eyes and sight. So when compare lupus anterior resinous exudation of an anterior toxic area, a deadly poison to a muscular system. It suspends both voluntary muscular action and that of the heart without causing a convulsion. Used in a Java as an arrow poison and differ in producing a clonic spasm, violent vomiting, diarrhea, great prostration, oxalic acid lupus when Briannia fails in a type. So dose of each is third to sixth potency. So this is a detailed description of a homeopathic therapeutics in the conjunctivitis. In this, we see the Upas tinete, Cilicia, Sepia, Ruta, Rustox, Pulsatilla, Pilocarpus microphyllus that is Jaborandi, Phytostigma, Phosphorus, Petroleum, Nitric acid, Nitromur, Mercurius, Lilium tea, Jaquirity, Hiparsulf, Guaria, Gelsemium, Ferrum phos, Euphrasia officinalis, Dulcamara, Duboisia, Conium, Cantharis, Colalum, Carbonium sulphuratum, Calcarea carbonica, Belladonna, arsenic alvum, Apis mellifica, Agaricus muscaris, and Aconite napellus. So, when we see these homeopathic therapeutics in detail, these are very useful remedy in a pustular inflammation, purular, palactular inflammation, gonorrheal inflammation, rheumatic, gonorrheal, follicular, diphtheritic, acute and subchronic and subacute acute conditions of the conjunctivitis. So, in today's lecture, we will see the homeopathic therapeutics of conjunctivitis, and from the next lecture, we see the diseases of cornea. So, till that, thank you all of you to attend the lecture and have a good day.